Good morning to all the nursing officers and aspirants. So, welcome you all to my educational YouTube channel, Master Nursing Classes. Myself, Mr. Nagraj, working as nursing officer at AIMS. So, in previous class, we have discussed very important basic questions and advanced questions related to the very important topic, that is neurotransmitters and the variations which occurs in the neurotransmitter which leads to the many diseases. Those are all diseases superficially we have studied in the previous class. So in today's class, it's a final prahar on the anatomy physiology of the neurology. After this class, we will go for the very important topics for your Norcet exams. Those all are your disease conditions of the neurology, which includes all type of the disease conditions like head injury, Glasgow Coma scale, and your seizures, Guillain-Barré disease, multiple sclerosis, each and every disease with nursing responsibilities and priority nursing actions we will discuss in detail. So if the any examiner want to ask the question, means he should ask from this topic and from this point, those point only. So other than that, we will not leave anything behind. So no need to worry, just follow the channel and share the content with your friends, colleagues, and your junior seniors. Okay, so without wasting the time, we'll start the class. And before going to our main class, we have one beautiful motivational quote for you: find a way, not an excuse. What it means, find a way, not an excuse, means if you are getting any kind of the problems while you are preparation, yes, that is the normal. The problems while a life of aspirants is normal. But the true aspirants, the true legends, finds a way. They will never ever excuse for anything. So they never ever compromise for their studies. So the true legends always finds a way to come out of their problems and not stuck in that particular problem. So if you are a true legend, if you are a true aspirant, so find a way, not an excuse. Okay. So without wasting the time, so we'll move for our today's very important class. Here is our simple first question. Yes, read the question carefully. First question is, covering of the brain and spinal cord is. So very basic question. Yes, answer please. So our first option comes the peritoneum. Option B is the meninges. Option C is pleural space. Option D is pericardial space. What is the covering layer of the brain and spinal cord? Covering layer of the brain and spinal cord is called. Yes, very good. That is your answer. Here it comes, the meninges. Okay, meninges is the covering layer of the brain and spinal cord. So what is peritoneum? Peritoneum is covering of the abdominal cavity. What is the pleural space? Pleural space is the covering of the what? S, respiratory cavity. What is the pericardial space? Pericardial space is covering of our heart. Okay. Here is one basic question that is related to the meninges. The covering of the brain and spinal cord is called meninges. Okay. So we will see what all are other questions may ask on the meninges. Okay. If examiner want to ask any question on the meninges, he should ask from these points only. Other than these points, the questions will not arise from anything regarding to meninges. Okay. Just focus on the slide. Okay. Covering of the brain and spinal cord is called meninges, which covers the our central nervous system. Central nervous system including our brain and spinal cord. So central nervous system is covered by simple answer meninges, and brain and spinal cord is covered by simple answer again meninges. Okay. So what all are the three layers of the meninges? Very important, because these layers covering our a vital organ of our body, that is called brain and spinal cord. Without brain and spinal cord, our body can't coordinate anything. Our body can't regulate anything. Okay. So brain and spinal cord are the very important organs in our body. So to cover that important organ, God created a layer called meningeal layer. So that layer have the three types of the layer. Okay. So from outside to inside, from outside to inside, we are having the three layers. First is our outer layer, that is dura mater. Okay. Name itself saying that Dura means durable, means it's an toughest. It's an outer and just toughest layer which having the 90% of role to cover the brain and protect the brain. That is our dura mater. Okay. Outer layer of the meninges is our dura mater. One more question. And toughest layer of the meninges is our dura mater. Okay. Here it comes our second point or the second layer, that is called arachnoid matter. Arachnoid matter is the middle layer. Our middle layer is the arachnoid matter. And another one questions may ask from this: which of the following meningeal layer looks like spider web? Our arachnoid, that is the middle meningeal layer, looks like a spider web. It's our state government question, because these simple questions may not ask in the Norcet exams, but you have to know that it's a basic. Okay, so let's go for our third points. That is the pia mater, the most innermost layer and the softest meningeal layer. Softest meningeal layer is our pia mater, that is present inside. Okay, so if the examiner asking from outside to inside, means this is your sequence DAP. Okay, here I will write from outside to inside. You have to remember DAP, dura mater, outer one, arachnoid mater, middle one, and pia mater, inner one. Very important. From inside to outside, examiner wants to ask, means you have to reverse this one as a pad. Means inside is pia mater and outside is dura mater, and the arachnoid matter remains middle. Okay, so very important. And one more points on your meninges. What is the inflammation of the meninges is called? Inflammation of meninges is called meningitis. In next class, we are dealing with a very important topic, meninges. So in the meninges, we will study entire details related to the what is septic meningitis, what is aseptic meningitis, what is fungal meningitis, what kind of the history may patient tells in the fungal and protozoal meningitis are very important, and what all are the CSF, cerebrospinal fluid variation in the our meningitis, very important, Brudzinski sign and our Carningsons. Each and every point we will study in the next meningitis class. So you have to know the basic, that is what is meningitis. Inflammation of the meningeal layer is called meningitis, very important. Okay, so we'll move for our next question. Here it is our next question. I hope you have cleared your things related to the meningitis. Okay, let's deal with this question. So let me read. CSF is produced from which part of the brain? CSF is produced from which part of the brain? Very important. Again, first question for your Norcet exams. So, okay. So here the questions may be short, but in examiner, this is the same question and examiner want to ask within another tricky formats. ಸುತ್ತಿ ಬಳಸಿ ನಿಮಗೆ ಇದೇ ಪರ್ಟಿಕ್ಯುಲರ್ ಕಾನ್ಸೆಪ್ಟ್ ನ ಕೇಳ್ತಾನೆ. ಸೊ ನೀವು ಅಲ್ಲಿ ಎಕ್ಸಾಮ್ ನಲ್ಲಿ ಕನ್ಫ್ಯೂಸ್ ಆಗೋದು ಏನ್ ನೆಸೆಸರಿ ಇಲ್ಲ. ಜಸ್ಟ್ ನಿಮ್ಗೆ ಏನ್ ಗೊತ್ತಿದೆ ಅದು ಹಾಕೋಕ್ಕಿಂತ ಆನ್ಸರ್ ಎಕ್ಸಾಮ್ನರ್ ಏನ್ ಕೇಳ್ತಿದ್ದಾನೆ ಅದ್ರ ಮೇಲೆ ಫೋಕಸ್ ಮಾಡಿ ಯುವರ್ ಆನ್ಸರ್ 100% going to be a right. Okay, so you don't want to put the answer what you have to know. Okay, here is our second question. CSF is produced from which part of the brain? Yes, very important. Option A goes thalamus, option B is our choroid plexus, option C is our subarachnoid space, and option D is our arachnoid villi. Very important point. So here is our answer. Option B was the correct answer. Okay, CSF is produced from which part of the brain? Is produced from the choroid plexus of the brain. Where is the choroid plexus located? Choroid plexus located in our lateral ventricles, third ventricle, and fourth ventricle everywhere. Here is our left lateral and right lateral ventricle. Left lateral ventricle, in between those, intraventricular foramen of Monro. Here is our third ventricles, and it comes our fourth ventricles. Okay, so up to fourth ventricles, laterally to open size Lasca. Okay, medially to open size Mezendi, and in our third ventricle and fourth ventricle, here is the opening that is called cerebral aqueduct of Salvius. Very important. Okay, so this is the most common site where obstructive hydrocephalus may occur due to the stenosis of the cerebral aqueduct of the Salvius. We will discuss that hydrocephalus topic in detail in next class slides. Okay, in next class. So here is our flow of the CSF occurs. The choroid plexus means the ependymal cells, the highly vascular parts of our brain. So where it produces the CSF in the ventricles and it flows in the ventricles, lateral ventricles to third to fourth, fourth to our subarachnoid space. Okay, subarachnoid space, that is below the arachnoid matter. Okay, so very important. Let us discuss the very important points related to cerebrospinal fluids that may ask in your exams. Okay, sorry. Here it comes your important points on the cerebrospinal fluid. Yes, the produces from CSF is produces from, very important, that is choroid flexus of brain ventricles. Where it produces only in lateral ventricles. No, CSF is producing from lateral ventricles, third and fourth ventricles also. It's an update. Keep in your mind, not only in lateral ventricles, CSF is produces in third ventricle also, and it produces in the fourth ventricle also. But the 90% of the production occurs from the lateral ventricles, from the quadriflexus, and the remaining 10% from the third and fourth ventricles. Okay, keep in your mind. If the examiner wants to ask site from where ventricles, from here which produces the CSF, means CSF is produced from lateral ventricles also, from third ventricle also, from fourth ventricles also. Okay, very important point. Keep in your mind. Okay, so the cells which are responsible for the production of the our cerebrospinal fluids. Again, one more important question, that is our ependymal cells. Okay, ependymal cells are the cells which are responsible for the production of cerebrospinal fluid in the ventricles of the brain. Okay, so here it comes the very important points again. Total volume of the cerebrospinal fluid. Okay, total volume of the cerebrospinal fluid is 50 ml, 150 ml. Okay, 150 ml is the total volume of the our cerebrospinal fluid. So it includes the both our ventricles and the subarachnoid space. Okay, so next question on the cerebrospinal fluid may arise like this: a rate of production of cerebrospinal fluid. Rate of production of cerebrospinal fluid. Examiner may ask per minute, per ml per hour, or ml per day also, or ml per 24 hours also. Okay, keep in mind I have mentioned all those 3 points here. The rate of production of cerebrospinal fluid is similar to the rate of production of our urine. Per minute, 0.5 ml per minute. Okay, or 30 ml per 1 hour. Okay, or 500 to 700 ml per 1 day or for 24 hours. Very important point. Keep in your mind, rate of production of cerebrospinal fluid per minute is 0.5 ml, per hour is 30 ml, per 24 hours is, yes, it's an 500 to 700 ml. Okay, per day. Very important. Okay, so what is the composition? What it includes? It includes the 99% of water and 1% of your, sorry, 1% of your, yes, organic and inorganic matters, or you can say solids. Okay, simply you can say solid. Here it is typing mistake. Let me erase this one. 99% it contains the water and 1% it contains the our solid. Okay, very important. And flow of the CSF. I have explained that flow of the CSF occurs from the ventricles towards the our subarachnoid space of the brain and spinal cord both. Very important. Okay, absorption of the CSF, where it absorbs. It absorbs from the arachnoid granules of superior sagittal sinus. Very important points. So this all 7 points is very important for your Norcet exams, and we are having the 2 more points on this. Opening pressure of the cerebrospinal fluid, very important. That is, see, mm of H2O. or of CSF or centimeter of H2O. So examiner many time asked this value of H2O. Okay, you have to know this one also in of CSF how much and in centimeter of H2O how much. Okay, opening pressure of CSF in of H2O it's 50 to 175 of H2O. Millimeter of water is 50 to 175 and your of CSF is 60 to 150 of CSF is your CSF opening pressure or 60 to 6 to 25 centimeter of H2O. So examiner may ask any value or he may give all these three options and your fourth options becomes all the above is the correct answer. Yes, your fourth option is the correct. All the above is the correct answer. If he is giving option A as in uh, 50 to 175 of H2O, option B as in 60 to 150 of CSF and option C as in 6 to 25 centimeter of H2O. Okay, very important. If he is giving answer as D, all the above, yes, the answer goes all the above. If he is asking relate to one question means focus on these values. So here is the immunity is different in all things. Okay, so first one is of H2O, of CSF, of centimeter of H2O. Very important point. Keep in your mind. Examiner may ask any value from here. Okay, so the next point is device which is used to measure the CSF opening pressure. That is the manometer. See, one trick I will tell you regarding to manometer. It will not apply everywhere. So just you can create a base for your answer regarding this. Wherever we will be monitoring the pressure, there we will use the manometer. Okay. For example, we are assessing the blood pressure. We use the device called sphygmomanometer. Okay. So we are assessing the CSF. So again we will use the manometer. Okay. So manometer is the pressure assessing device where we will assessing the pressure from the CSF. Okay. Very important point. So hope all the points related to cerebrospinal fluid is clear for you. So let me move for the next question. So next question is seems to like this. Which part of the brain is responsible for coordination, muscle movement, posture and balance? Very important. Okay. So ಬಾಡಿ ಬ್ರೈನ್ದು ಯಾವ್ದು ಪಾರ್ಟ್ ಇಂದ ನಾವು ಕೋಆರ್ಡಿನೇಷನ್ ಮೇಂಟೈನ್ ಮಾಡಬಹುದು, ಮಸಲ್ ಮೂವ್ಮೆಂಟ್ ಮೇಂಟೈನ್ ಮಾಡಬಹುದು, ಪೋಸ್ಚರ್ ಅಂಡ್ ಬ್ಯಾಲೆನ್ಸ್ ಮೇಂಟೈನ್ ಮಾಡಬಹುದು. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ a question for your exam. So yes, try to answer here. So which part of the brain is responsible for coordination, muscle movement, posture and balance of our body? Okay, option A goes the cerebrum. Cerebrum is not responsible for coordination, muscle movement, posture, balance. So cerebrum, to study the cerebrum, we study the it's in largest part of the brain. Okay, it's in largest part of the brain. So to study this one easily, we have divided the cerebrum into lobes. That is, here it comes your cerebrum. We have divided it into the frontal lobe, parietal lobe, occipital lobe, temporal lobe. Okay, for each study. So I have explained each and every lobe function in detail. My theory explanation class, a very important class for your exam. So do watch my theory video after completing this video. Okay, for in detail complete explanation related to the functional area. So I explained all the thing where the Broca's area present, what is the primary auditory center, what is the secondary auditory center, what is the primary visual center, what is the secondary visual center, where's the Wernicke area is present. So what is the area responsible for your sensation? Everything in detail explained in the theory class. Please do watch my theory class after completing this session. Okay, so our cerebrum is largest part of the brain. We divided the cerebrum into lobes for easy study purpose. Okay, into the frontal lobe, parietal lobe, occipital lobe and temporal lobe. Okay, by our fissures. Okay, so next option is the cerebellum. Cerebellum is also called as the little brain of our body. Okay, little brain of our body. It's a friend-like structure. Okay, it's a friend-like structure which is behind the our brainstem. Okay, very important point. So here is the question comes for the like this. The part of the brain responsible for the coordination, muscle movement, posture, and balance is our cerebellum. So cerebellum is the little brain of the body, is responsible for the maintaining the or muscle movements or coordination, posture, balance. Okay, imbalance in our muscle movement, coordination, posture, balance. We call the term that is an ataxia. What is ataxia? Ataxia is an imbalance between the coordination, muscle movement, posture, and balance. It's called ataxia. Very important. Okay. So here it comes our next option: medulla oblongata and pons, which all are the part of the brainstem. We will deal with this in the next questions. Okay. So our answer in this topic goes to in this question goes to option B. That is the cerebellum. Cerebellum is the responsible for our coordination, muscle movement, posture, and balance. Okay. So let me forward for next question. Here is your next question. Very important question for your Norcet and very basic question. This question asked in 1,000+ nursing exams. Okay. So this is the repeated asking questions. So you have to know these basic questions. Okay. ನಿಮ್ಗೆ ಒಂದು ಕಾಂಪ್ಲೆಕ್ಸ್ ಕ್ವಶನ್ಗೆ ಆನ್ಸರ್ ಹಾಕ್ಲಿಲ್ಲ ಅಂದ್ರೆ ನಿಮ್ ರ್ಯಾಂಕ್ ಅಲ್ಲಿ ಏನು ಆ ರೀತಿ ವೇರಿಯೇಷನ್ ಬರಲ್ಲ. ಬಟ್ ಸಿಂಪಲ್ ಕ್ವಶನ್ ಎಲ್ಲಿ 1,000 ಔಟ್ ಆಫ್ 1,999 ಮೆಂಬರ್ಸ್ ಕರೆಕ್ಟ್ ಆಗ್ತಿದ್ರೆ ಆ ಕ್ವಶನ್ ನೀವು ರಾಂಗ್ ಆಗ್ತಿದ್ರೆ ನಿಮ್ಗೆ ಆ ಆ ಪರ್ಟಿಕ್ಯುಲರ್ ಒಂದು ಸಿಂಪಲ್ ಕ್ವಶನ್ 1,000 ರ್ಯಾಂಕ್ ಹಿಂದ್ಗಡೆ ಹೋಗಿ ನಿಲ್ಸುತ್ತೆ. ಓಕೆ, ಸಿಂಪಲ್ ಕ್ವಶನ್ ಗಳ ಮೇಲೆ ಫೋಕಸ್ ಮಾಡೋದು ಬಹಳ ನೀಡ್ ಇದೆ. ಸೊ ನೀವು ಕಾಂಪಿಟೇಷನ್ ಅಲ್ಲಿ ಇರಕ್ಕೆ. ಓಕೆ, ಸೊ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. So question is like this: our respiratory center and the cardiac center is situated in. Yes, our first option comes the medulla oblongata, second is pons, third is thalamus, and our option D is the cerebellum. So we have discussed regarding the cerebellum. That is the cerebellum is responsible for, yes, muscle movement, coordination, posture, balance. So imbalance in these things we call the word called ataxia. Okay, so and thalamus, that is the relay station of our body where all the sensory stations, so all the sensory signals are going through the our thalamus. Okay, so except the olfactory, but in updated versions of the our new anatomy physiology books, it's mentioned that olfactory also a part of the thalamus sensation which is regulated by the thalamus. Okay, very important. Yes, our next option goes to the pons and option A is the medulla oblongata. Okay, respiratory center and cardiac center is situated in the medulla oblongata. Very important. Okay, here is our right answer. Option A, medulla oblongata. Okay, so let me move forward for our next question. Here is our next question: which part of the brain controls the activity of the autonomic nervous system? Okay, which part of the brain which controls the activity of the autonomic nervous system? Very basic question, very easy question. Okay, answer the question. Option A is the thalamus, option B is hypothalamus, option C is cerebellum, option D is ganglia. Yes, answer the question. Very basic question. Yes, autonomic nervous system is controlled and regulated by the hypothalamus. Okay, hypothalamus is the center where it controls and regulates the autonomic nervous system. Okay, hypothalamus is responsible controlling the temperature. Hypothalamus is responsible for controlling the eating habits. Very important. And hypothalamus is a very integrate part of the endocrine system. Okay, hypothalamus. So as endocrine system I told, in this one it releases the, yes, very important, gonadotropin releasing hormone. So which is responsible for our FSH and LH stimulation. So it is also having the role in the reproduction. Okay, hypothalamus is also having the role in the reproduction. In my theory class, entire thing I have explained related to the hypothalamus. I have took on very separate important separate class on the hypothalamus and thalamus. please do watch my theory video after completing this session. Okay, so very important points. Hypothalamus is responsible temperature, maintaining the temperature, eating habits, endocrine system, reproductive system, and many things. So I have explained each and every points in my theory class. Do watch that class. Okay, so here is our answer for the question: which of the part of the brain responsible for controlling the autonomic nervous system? That is also our hypothalamus. Okay, and cerebellum is responsible for the coordination, muscle movement, and posture balance. Explained. And what is the ganglia? What is the ganglia? Yes, answer, guys. What is the ganglia? What is the difference between the ganglia and the nucleus? Here is the difference between the ganglia and nucleus. Group of the nervous cell body inside the central nervous system is called nucleus. Here is our nerve cells body, and here is our axons. So group of these nerve cell body in the CNS, that is includes the brain and spinal cord. Group of the nerve cell body, or the group of the gray matter in the brain and spinal cord is called, yes, nucleus. And group of the nerve cell body outside the CNS. In the CNS it's called nuclei, outside the CNS it's called ganglia. Very important. Okay. So group of the nerve cell body, we say, or we say this one as the group of the, yes, gray matter. Okay. Here it comes for the this question answer as an answer B. That is a very important. Autonomic nervous system is regulated by our hypothalamus. Okay. So hope I have cleared this question for you. Here is our next question. Collection of the nerve fibers which connect the two hemispheres is called as. So in our cerebrum we are having the two hemispheres, that is the right hemisphere and another one is left hemisphere. Okay. So this is held by the our group of the thick nerve fibers. This what we call the this thick nerve fiber which holds the right and left hemisphere. That is called, our answer is option C. That is called corpus callosum. What we call, that is the these nerve cell fibers we call the corpus callosum, which is responsible for holding the both right and left hemispheres are held together by our corpus callosum. Okay, so we are having the two hemispheres, that is the right and left hemisphere. As all of you know, in the person who is having the right hand dominant, his left hemisphere is dominated, and the person who is having the left hand dominant, his uh, right hemisphere is dominated. Okay, so we call this as a contralateral effect. Okay, so very important point where we will study while studying the paralysis, where the left hemisphere is paralyzed means our right body part will get paralysis, and our left hemisphere get paralyzed means our entire right body get paralysis. Very important. Okay, so this is the basic you need to understand here. Okay, so collection of the nerve cell fibers which connects the two hemispheres is called corpus callosum. Okay. So glial cells are our supportive non-excitatory cells of the nervous system, which responsible forming the very important our blood-brain barrier, which is formed by astrocytes, and for the myelination by our oligodendrocytes, and for CSF production ependymal cells, and our macrophages of the CNS, that is our microglial cells. Very important glial cells. I have discussed this glial cells topic very important separately in my theory class. Do watch that class for your best preparation of the exam. Okay, so here it comes, our next option B is the nerve cells. As all of you know this is called structural and functional unit of our nervous system. So nerve cells having the various body parts. I have explained that one also in theory class. Okay, and here it comes our brain stem. Brain stem having the three parts, that is the midbrain, pons, and medulla oblongata. Very important, three parts of the brain stem. Okay. So our answer for this question goes to corpus callosum. Okay. Here is our next question. So normal intracranial pressure. What is the normal intracranial pressure? Don't confuse between the cerebrospinal fluid opening pressure and normal intracranial pressure. That is very different topic and it is very different. Okay. So normal intracranial pressure is, yes, answer guys, very important. Option A is the 5 to 15 mm of Hg. Option B is the 10 to 21 mm of Hg. Option C is the 35 to 45 mm of Hg. Option D is the more than 20 mm of Hg. Yes, very good. Very simple and basic question, which this question asked in many exams many times. Okay, very important. So here it comes your answer for the question. Normal intracranial pressure is 5 to 15 mm of Hg. This is our answer of this question. Okay. So 10 to 21 mm of Hg is our normal intraocular pressure, our IOP, intraocular pressure, that is pressure present in our anterior chamber of the eye due to the aqueous humor. Okay. So due to increased intraocular pressure, we study the very important disease condition that is called glaucoma. Open angle glaucoma, close angle glaucoma. We will study that entire glaucoma topic in our next classes in detail, theory and MCQ. Okay. So here you have to keep in your mind the normal intraocular pressure is 10 to 21 mm of Hg, millimeter of mercury. Okay. And here is our option C, that is our 35 to 45 mm Hg. 35 to 45 mm Hg is, yes, it's our normal pulse pressure. It's a normal pulse pressure. Okay. So option D, more than 20 mm of Hg. Examiner may ask the question like this also. If the intracranial pressure goes more than 20 mm of Hg means the brain herniation occurs. Very important. Brain herniation occurs when the intracranial pressure goes beyond the 20 mm of Hg, where our part of the brains are protruding. So, which leads to the obstructive and non-obstructive kind of the, so hydrocephalus in the babies or newborns, and in the adults it may leads to the seizures also. Okay. So here it's the answer for the question. So normal intracranial pressure is 5 to 15 millimeter of mercury. Okay. Here it comes our next question. So area responsible for understanding the speech. Which of the following areas which is responsible for the understanding the speech? Yes, tell me answer. Which of the following is the area responsible for the production of the speech? Yes, the production of the speech answer goes the Broca's area, which is present in our frontal lobe. Okay, which is present in our frontal lobe. Damage to the frontal lobe may leads to the damage to the Broca's area, and damage to the Broca's area may leads to the damage to the production of the speech process. So, loss of production of the speech leads to expressive aphasia. You are unable to express anything because your speech is interrupted. So, that is called expressive aphasia. You are unable to express anything. So, when expressive aphasia occurs when your brain frontal lobe got damaged and the Broca's area got damaged. At that point of the time, you are having the expressive aphasia. Okay. Here it comes our next question. Next option, that is the Wernicke's area. Yes, the area which is responsible for the understanding the speech. Whatever the things which are said by others, we are understanding because our Wernicke's area is normal. Where it located? Wernicke's area is located in our temporal lobe. Okay, temporal lobe of our brain. Here it our Wernicke's area is present. So whatever we are hearing, we are understanding. Whatever we are visualizing, we are understanding because of our Wernicke's area is normal. Okay. So if you got damage to the Wernicke's area or the temporal lobe, there may be loss of understanding of the speech. That is called, yes, that is called receptive aphasia. You are unable to receive the speech whatever told by the others. because the vernix area is the damage. Understanding process is damaged. So that is called unable to receive. So receptive aphasia. You are unable to express. Loss of production of the speech. That is the Broca's area damage. That is the expressive aphasia. Okay. Very important difference you have to understand here. This is the question may ask in your exam directly like this only. And also examiner may twist the questions like this. So nurse is saying something to the patient. Patient is unable to understand that particular thing. So which part of the brain is got damaged? Option A is the temporal lobe. Option B is the vernix area. Option C is the both A and B. Option D is none of the above. Yes, option C goes the both A and B. Your vernix area or temporal lobe both got damaged. So because of that, you are unable to understand the speech. Okay. And here it comes our hippocampus responsible for the memory and cerebellum. So all we have seen regarding the cerebellum. Okay. So hope I have cleared your thing very much easily. Here is the answer for our question goes the vernix area. Area responsible for the understanding of the speech is vernix area. So damage to the vernix area is called yes, receptive aphasia, unable to understand the speech whatever told by the others. If damage to both Broca's area and vernix area, unable to produce the speech also and unable to understand the speech also. That is called global aphasia. Okay, global aphasia, very important. Here it comes our next question. So, which cranial nerve is responsible for the anterior two-third of the tongue sensation? So, we are having the tongue like this. This is our beautiful oral cavity, and here it comes our tongue. Okay, this is the anterior two-third of the tongue, and here is the posterior one-third of the tongue. So, tongue movement occurs due to the which cranial nerve? That is the our 12th cranial nerve. Name of the 12th cranial nerve is? Yes, very importantly. Hypoglossal nerve. Hypo means below, glossal means tongue. So it's arises tongue, below the tongue and which is responsible for the movement of the tongue. That is the hypoglossal nerve. But the examiner is asking for sensation of the anterior two-third of the tongue. Sensation means sensory nerve. Which of the following is sensory cranial nerve which is responsible for the taste or sensation of the anterior two-third of the tongue? Yes, and here it comes the answer is the facial nerve. Facial nerve is the mixed nerve which is responsible for so movement of our face also and which supplies our part of the faces and responsible for the movement and which is the sensory nerve also. So because of that the cranial nerve number 7 facial nerve is also called as the mixed cranial nerve because it is having the both sensory and motor function. Okay, very important. So the anterior tooth or two-third of the tongue is supplied by our facial nerve, that is the cranial nerve number 7. So taste which we are perceiving in the anterior two-third of the our tongue, which is due to the 7th cranial nerve, that is the facial nerve, and the posterior one-third of the tongue sensation or the taste occurs due to the our glossopharyngeal nerve. Okay, the question is regarding anterior two-third means our answer goes to option C, that is the facial nerve. Okay, here is our correct answer. Okay, and trigeminal nerve, which is the largest cranial nerve, which is having the three supplies. Okay, three supplies, two sensory and one motor supply. Okay, two sensory and one motor supply: ophthalmic, maxillary, and mandibular. Okay, ophthalmic which supplies the sensory part of our eye. So and mandibular and maxillary. Okay, maxillary is the motor supply where which is supplying the a muscle of mastication. Whatever we are chewing like this, that is due to the our muscle of mastication. Mastication means the process of chewing is called mastication. That is supplied by our very important mandibular branch of our trigeminal nerve. So because of that, we are chewing normally. So trigeminal nerve is the nerve which are having the three branch, which includes two of sensory branch. That is the ophthalmic and maxillary is the sensory branch, and the one motor branch, that is the mandibular is the motor branch. Very important. So I have explained each and every cranial nerve in detail in my theory class. So each and every cranial nerve, how we will study which of the what all are the sensory, what all are the motor, what all are the mixed nerves, from where it originates. Each and every point I have explained in detail related to the cranial nerve. Please do watch my theory class after this MCQ session. Okay. Let me go for the last question of the day. That is the a very important question. Nursing officer asking to raise the eyebrow and smile and show the teeth, which cranial nerve function he or she is assessing. So, a nursing officer is working in the hospital session. He is asking the patient to raise the eyebrow like this, and he is asking to smile like this, and he is asking to show the teeth. Okay. So, which cranial nerve function he is assessing? Yes, he is assessing again the motor branch of our facial nerve. Okay. So, our olfactory nerve is pure sensory nerve. Okay, responsible for the smell. So we assess the olfactory nerve like this. We will ask the patient to close his eyes, and we will keep something, three different smells near to his nose, and we will ask the patient what kind of the smell you are getting. Okay, that is assessment of the olfactory nerve. Okay, and we are having the oculomotor nerve. That is our, yes, with cranial nerve, olfactory is the first, oculomotor is the third, optic is the second. Okay, so optic is the second cranial nerve, olfactory is the, oculomotor is the third, and olfactory is the first. Okay, facial is the seventh. So oculomotor nerve, which is responsible for the movement of the eyeball, except lateral rectus, which is regulated by the sixth cranial nerve. We remember this one as LR6, and our superior oblique, which is responsible, which is regulated by our fourth cranial nerve. Okay, that's the abducens. So, sorry, fourth cranial nerve is the trochlear. SO4 is trochlear, and our LR6 is abducens. Okay, here we will remember the movement of the eye muscles. I have explained which all are the muscles and cranial nerve responsible for the direction, including the direction of the eyeball movement in my theory class. Okay, so here it comes our option D, that is the optic nerve, which is responsible for the carrying the sensation from the retina of the eye. Okay, here it comes our three layers of the eye like this. Let me erase this one. 1 minute. See, what is this? This is cornea, and here it comes our sclera. Okay, and here it comes our iris, that's the coloring part of eye, and here it comes our uveal tract includes the iris, a ciliary body, and our choroid layer. Okay, all these three things includes the uveal tract. Okay, inflammation of the uveal tract is called uveitis. We will discuss while studying the ophthalmology. Okay, so here it comes our middle layer, and here is our inner layer, that is the sensory neuronal layer of our eye, that is called retina. That is called retina. Okay, retina is supplied by optic nerve. So optic nerve, which will go to our occipital lobe. Okay, for the vision perception, very important. Here is the end of our today's class. If you find this video helpful for you, please do share the video and subscribe to my channel, and help me to reach to those students which are actually wants to study for their nursing officer recruitment exams. So thank you for watching the full video. We'll meet in the next class. Thank you for believing in the master nursing classes. Thank you.